two organizations with the same goal.
Just working together to impact the kingdom of God.
Because the most important thing to service is compassion.
And love to everyone through the love of Christ.
There's a lot of need here in the community, and the Luke Commission.
They find solutions to problems.
My name is Echo Vanderwall. I've been working at the Luke Commission for the past 20 years. I'm the executive director.
I'm Dr. Joe Johnson. I'm the Dean of Liberty University's College of Osteopathic Medicine.
This week at the Luke Commission, we have a number of medical students from the Liberty University visiting us. This is a part of their broader program of global medicine and is enabling them to interact with us in this setting.
And this is a partnership that we've been praying about and have been hoping would be developed and mature over the last several years, actually maybe close to a decade.
So we're always looking for areas where we can partner with Christian organizations to be able to really allow medical students to see the global impact not only of medicine, but how they need to realize that every single patient that they deal with has not only a medical side, a psychological side, but a spiritual side that needs to be taken care of.
There are a number of reasons that we have decided to partner with Liberty University, and I think in one setting they share a common core value with the Luke Commission, and that is on compassion.
Because we believe that together we can do things that could never be done apart. We have both committed to excellence in our different areas where we have spent time seeking God's face, and now we're able to exponentiate that work moving forward as we journey together into the next season that God has for us.
Liberty wants to train champions for Christ, to really be able to teach others what it's like to love like Christ, and to live like Christ. I see the same thing in the Luke Commission.
Hi, my name is Lauren. I'm from Minnesota.
Hi, my name's Bella. I'm a rising senior at Liberty University in pre-med. When we first arrived at the Luke Commission in Eswatini, my first impressions were just the way that they were able to incorporate efficiency and streamlining along with compassionate care and quality health care.
I was honestly blown away by the facilities. I did not expect it to be its own almost little town.
When I first arrived, my initial impressions were just how beautiful this place was.
I was really impressed with the infrastructure and how the whole group was built around.
And we really felt like we were a part of the family.
The team culture here at the Luke Commission is amazing and something that I think should be replicated in many other places. They all work together really well and they don't even have to ask. Oftentimes I'll see doctors saying, oh, I can do this for you because I know you have this on your plate right now. And they just do that without even being asked and do that really well and work together in a great way.
This being my first time overseas, it was very interesting experiencing how the Luke Commission goes about handling healthcare compared to what I'm used to seeing back home. Without a doubt, when the Luke Commission says that they approach healthcare with compassion, they mean it. They show compassion with every aspect of how they treat their patients and within their community.
They're really able to reach the entire community with the services that they have. And it's just been really great to see that they prioritize everyone in the community from babies all the way up to the end of life.
In terms of how my perspective has changed, I think I've learned a lot that healthcare is not one way. There's not one perfect way to healthcare, and there's a lot of other factors that contribute to somebody's care that we might not necessarily think about in the United States, like somebody's ability to get there, transportation, and access. So that's been a huge part of what we've been learning this week.
When we were able to go on a homestead visit and visit one of the members of the community who also happened to be an employee at the Luke Commission here in Eswatini, and he lived in a very small home and there was no running water or electricity, but he just talked about how much joy that he had in the Lord and just how grateful he was just for the breath in his lungs. And I think that really impacted me, thinking about how I have so much and he has so little, yet he just has so much joy.
Good. Bye-bye. God bless you.
Even does outreach. They go to people's homes if they're unable to get here. They go and pray with people in the mornings before the day starts. They truly just encounter the patient wherever they're at and help them to feel loved and seen and also cared for.
I have seen on this campus that they come across many problems, and anytime they come across a problem, they find a solution for it.
From where I come from, it almost seems like patients think that medical care is a right that they have, but here at the Luke Commission, the patients are just so grateful and genuinely appreciative of any help that they're able to receive.
And so we're really, really grateful because of the multidisciplinary approach that's being taken in this relationship. It was something we've prayed for a very long time, and we're really grateful to have a university of the caliber and size and scope and capacity that Liberty has to be able to partner with us.
The Eswatini people have been very, very kind to us. They've been very generous in what they have done, what they have presented us with, what they have taught us while we're here. And I think one of the challenges that we see is that relationships need to be long-lasting. It takes time for us to be able to understand a culture, for them to understand our culture, for us to be able to build working relationships with each other in such a way that trust is built. Because without trust, you can't move things forward.
I would say you should care about what's happening here at the Luke Commission because it's changing lives and hearts. There's a lot of need here in the community, and the Luke Commission is helping to provide for those needs by listening to the patients that come and offering care and compassion and service. So I think it's something that everyone should value.
Even though Eswatini is a small country and they do have limited resources, TLC is using all that they have really for their medicine
And treating patients in the way Jesus would want patients to be treated.